The topic of this video lecture is therapeutic window and therapeutic index. Before we move into the topic, it is important to understand drug effects after drug administration. The given figure shows the drug effect over a period of time after drug administration. The x-axis represents time and the y-axis represents the drug effect. Following drug administration, the plasma concentration of the drug gradually increases. Onset of drug effect is seen only when the plasma concentration of drug exceeds the minimum effective concentration of desired response. It is observed that the intensity of drug effect increases as the drug is absorbed and distributed. This results in a peak, after which the drug elimination results in a decline in plasma concentration. The drug effect disappears when the drug concentration falls below the minimum effective concentration of desired response. So there is a minimum effective concentration of desired response beyond which the onset of effect is seen, and below the minimum effective concentration of desired response, the response becomes subtherapeutic or the response disappears. Next is the duration of drug action. The duration of drug action is determined by the time period over which the drug concentration exceeds the minimum effective concentration. Also, there exists a minimum effective concentration for each adverse response. If the drug concentration exceeds this, toxicity results. So the therapeutic goal is to obtain and maintain the drug concentration within the therapeutic window. So what is therapeutic window? Therapeutic window is the range of doses, that is, the concentration of a drug that elicits a therapeutic response without unacceptable adverse effects or toxicity in a population of patients. Therapeutic window can be quantified by the therapeutic index or therapeutic ratio. So what is therapeutic index and what is its significance? The graph shown here reflects the therapeutic index. The x-axis represents the dose and the y-axis shows the percentage of people affected. The blue curve represents the therapeutic effect, that is, the dose of the drug that is therapeutically effective in 50% of the population. This is known as effective dose for 50% of the population, which is ED50. The red curve represents the dose of a drug that causes a toxic response in 50% of the population. TD50 is the dose of the drug that causes a toxic response in 50% of the population. So therapeutic index is equal to TD50 divided by ED50. So toxic dose in 50% of the population divided by effective therapeutic dose in 50% of the population. What is the significance of therapeutic index? If a drug has high therapeutic index or wider therapeutic window, it indicates that a drug is safe. Examples of drugs which have high therapeutic index or a wider therapeutic window are aspirin, amoxicillin. If a drug has low therapeutic index or narrow therapeutic window, it implies that there is increased risk of toxic effects. Examples of drugs which have low therapeutic index are digoxin, lithium, theophylline, phenytoin, tricyclic antidepressant, heparin, etc. For these drugs, close monitoring is required to avoid the risk of adverse responses. These are my references. Thanks for watching. Please like, subscribe and share.